Hi, I'm Dr. Angela Mattis, consultant ophthalmologist at AB Vision Eye Care, and welcome to our monthly session, Ask Me, where I answer your pressing questions on conditions relating to eye diseases. Today, we have a question. It says, Dr. Mattis, my job requires me to spend more than 6 hours every day on the computer. At the end of the workday, I get a headache and my vision is blurry. Please advise me on tips to protect my eyesight while on the computer. But first, let me say, the computer does not cause eye problems. It is the use of the computer. And if we dissect this question, this person spends more than 6 hours a day on the computer. And you might say, oh, that's the work day. Yes, but you have to, when you're on the computer for a long time, be mindful of how you use it. So, we talk about computer eye syndrome, eye strain, and what are we talking about? Now, these are terms which describe the effects of being on the computer or doing close work for a very long time. So we have blurred vision, we get eye ache and eye strain and headache, and sometimes the eyes get watery and they burn. These are some of the symptoms of concentrated near vision work for a long time. We also see this in persons who read for a long time, do close work like sewing, crocheting, and so on, driving for a long time. And so, what is eye strain really? Eye strain occurs from prolonged use of the computer, or as I stated before, any close-up work. So you get blurry vision, you get watery eyes, you get burning to your eyes, and sometimes your eyes just feel achy. What also is dry eye syndrome? Dry eye syndrome also encompasses the whole computer digital syndrome. And so dry eye syndrome comes from prolonged use again. We usually blink approximately every 10 to 15 seconds. And when you're doing very concentrated near work, we tend to blink less often. Blinking is important to spread our tear film. The tear film is what coats the eye and keeps our eye moisturized. So when we do not blink, the tear film evaporates and our eyes start to burn and we get a watering. And sometimes patients will say, how come my eyes are dry and they are watering at the same time? And that's exactly what happens. It's an attempt to re-moisturize your eye, that signal when your eye gets dry and starts to burn. So that signal goes to your tear gland to produce more tears. But we are producing watery tears and not the components of oils and mucins which help to lubricate. So that is why you get a watery eye when you have a dry eye. Now, how can we take care of our eyes while we use the computer? Firstly, please ensure that you have your most current glasses prescription. Also, you need to be aware of the ergonomics when you're at the computer. You want to be sitting approximately 25 to 28 inches away from the computer screen, and also your computer screen should be approximately 3 to 5 inches below your eye level. Another important tip is to get a good night's sleep. A good night's sleep can reduce some of the symptoms that we described earlier about being tired and the eyes being tired as well. So in response to this question, I would advise this person, firstly, if you do not wear glasses, please get your eyes tested to determine if you need glasses, because as you stated, while you're at the computer, your eyes get blurry. Also, if you do wear glasses, please make sure you have the most up-to-date prescription. What about blue light blocking glasses? Blue light blocking glasses are fine. They work well for some patients who mention that they have migraines and it can reduce the onset of migraines, and that is fine. If you find that the blue light blocking glasses work for you, sure, go ahead. What studies have shown is that it does minimize the blue light and it can prevent disruptions to your sleep cycle and so enhance a proper night's sleep. So go ahead with your blue light blocking glasses if you find that they work well for you. Right, we just spoke about workplace eye conditions concerning the computer, but we have lots of other workplace eye injuries, and that is very important. Eye injuries are commonplace and they occur every day. Now, what are the type of workplace eye injuries that exist? We talk about flying objects, dust, dirt, and debris, which can be flying around in your workplace, which can cause injuries. There are also chemical injuries, persons who work in laboratories or in the manufacturing sector where there are lots of liquids and so on, like bleach, that can cause splashes in the eye. We also have machinery and tools, for example, persons hammering and machines that have very high velocity particles that can cause very serious eye injuries. And those eye injuries can result in blindness. As a matter of fact, eye injuries causing one eye or unilateral blindness is one of the most common things out there. So we have to take care at the workplace to ensure that we do not end up losing our sight from workplace eye injuries. How can we prevent workplace eye injuries? First, we have to have the proper safety eyewear. There are safety glasses, there are safety goggles, and there are eye shields. And you must wear these equipment to protect your eyes. I so often see patients who come in who are using welding materials and so on, and they come in with metal particles stuck on their eyes, and they say, "Doc, just as I took away my eye shield, something got in my eye." If you remove your eye shield, you must stop working. Also, you have to ensure that the employees are educated as to the use of these eye care equipment. And thirdly, we have to install barriers. So if you're in an environment where there are lots of debris flying, you have to ensure that there are barriers so that you do not get these particles flying in your eye. There are actual protocols in certain workplace if you get injuries. For example, if you are working with chemicals, there's an eye wash station, and you must be familiar with the protocol in your establishment if you get chemicals or a splash in your eyes. Secondly, anything else, you want to ensure that you seek early medical intervention and try not to treat things on your own if you're unsure. It's always best to have yourself checked out to prevent things getting much worse. Thank you for watching. I'll see you next month for our next insightful session on eye care. And please remember, if you have any questions, please drop them in the comment section below.